Good afternoon, everyone. My name is Tony Nunes, and I'm with AMD. I'm a senior manager leading our efforts in the healthcare life sciences sector. Very honored to be here among this very august group. And Eric, that was one of the best presentations I've ever heard on this. So congratulations. So my background. I've been in healthcare life sciences for over 25 years. I've been with AMD a little over a year now, but prior to that, I was with Dell Technologies, EMC, then Dell Technologies, and I was working the entire time in their nascent healthcare life sciences team, starting in the late 90s till just about a year ago. And most of my role was spent as a technologist in being able to integrate platforms for medical imaging, primarily archiving them. But I also moved into the field to try to understand from the macro perspective the role that technology plays in healthcare delivery, both in the United States and internationally. I ran Latin America for a number of years. And so the discussion today is to follow up on things that Dr. Reedy said and Eric brought up, and that gentleman asked a few moments ago in terms of the deployment of this and why technologies that normally aren't thought of as being foundational truly are. And in fact, that's the focus of what I'd like to discuss for the next few minutes, is AMD as a foundational technology for digital health, or for the acquisition of digital health. So, many of you are probably familiar with what we do. This is our 50th year as a company. But more specifically, I want to focus on the last 6 years. The graph you see up here is our level of penetration in data center and cloud since 2018. And this is specifically for our EPYC generation of CPU processors. In 2018, where we essentially had zero market share, to as of the end of this past year, we're now at 35%. And this is a hybrid amalgamation of on-site data centers and cloud. Nowhere, no company has had this level of penetration and success in so short a period of time. And the reason is why? Well, the first one is this: it's consistency on delivery. AMD, and a lot of this goes to the leadership of our CEO, Dr. Lisa Su. Many of you may be familiar with her. She's an extraordinary person and has truly transformed the company in roughly the same amount of time. Consistency in delivery and promises of feature sets and performance that we make. This has led to the adoption. In fact, in cloud, we're over 50% in terms of deployment internally for cloud systems. 35%, and we will confidently be over 50 in the next 2 years. Why is this important? It's not just that it's a processor, but there are certain functions, certain feature sets that are important for any data center that's going to adopt the new levels of AI technology going forward. And some of them are quite basic, right? There's economies of running the data center. There's a certain amount of modernization that has to take place. There's consolidation. There's mundane things around total cost of ownership and how you integrate mixed workloads. Well, let's take a look at some of these. I'm going to refer specifically right now just to the EPYC CPU. I'll integrate other platforms that we have as we go through this. We just released our 5th generation processor. Internally, it was known as Turin. We have this affinity for Italian cities. So we've had Rome, we've had Milan, we've had Genoa, and now we're on Turin, and at some point in the future, there'll be Venice. Turin was released, Generation 5 was released just a few months ago, and it has the best performance of any platform that's been evaluated on the marketplace, up to 192 cores, 384 consistent threads, 5 gigahertz, and unique to AMD, a set of embedded security capabilities directly in silico. So what does this mean? There's a certain amount of challenge around virtualization software, specifically with Broadcom and the pricing for VMware, where they now based on the number of cores is how they license the software. Because of the design of our chip architecture, we're able to make each of the cores far denser than other cores that are available on the marketplace. And as a result, we can reduce the overall cost, both in space in the data center and licensing costs because of that, and all the environmental costs that are associated with it, which is an important factor across the board. The necessity for energy is going to be one of the biggest driving factors for investment in the data center going forward, whether it's cloud or whether it's on-site. The fact that Microsoft has exclusive use to the newly renovated 3 Mile Island, I still have difficulty getting my head around this, is the model that we're going to continue to see, including investment in smaller, perhaps nuclear technology that's going to be deployed. The use of AI, and Eric will probably make this great, the use of AI is going to drive the demand for energy in ways that haven't been imagined in a long time. What does this mean for healthcare, though? Well, the way we define the healthcare industry is a little bit broad-based. So there's a traditional provider space, hospitals, and that still makes up the bulk of the work that we do at AMD in my own group. But there's also the insurance payer side. There's also the medical device side. There's the research side. There's the pharma side. And so when we speak about healthcare, it's with all of these different elements in mind. And so for running traditional clinical platforms, your electronic health record, whether it's your PACS system from Fuji or from AGFA, et cetera, there are certain requirements different from what you would find for traditional drug discovery or genomic research, where high-performance computing becomes more of a play. I'm not going to single out artificial intelligence because really this bridges the gap across the entire spectrum, and it has to be looked at in that way. And in fact, if you look at the adoption models, it starts not in the data center, but at the edge, as Eric was mentioning, from AI-enabled PCs, all the way through to the cloud. So what's the performance like? Well, clearly it's going to be better. I wouldn't be up here talking if it wasn't. But the level of increase, and this is against some other platforms that exist, is magnitudes higher in some cases. And this is across the board. So as we look why the adoption has been so successful, well, performance is one thing, consistency of promising on those features is another, but then there's the actual results. The same holds true in the cloud, for different reasons. Cloud providers and hosters are going to be looking at something that allows them to reduce the cost. And that's the primary motivation. Slightly different if it's on site. But in both cases, greater performance equals lower cost. And this is why the adoption of AMD, and in fact, why one of our key partners like Supermicro has adopted this, is because ultimately, for the healthcare provider, it's going to equal a lower cost for deployment and usage. To give you an idea of why this is important specifically, why healthcare is important specifically, last week, Lisa Su acquired a company called Absci. And you guys see this? I confess I don't know much about Absci. I was just made aware of this really after the weekend. But AMD is banking on our ability to change the whole nature of drug discovery. This will not be the last acquisition, if I had to guess, by investing directly in these areas as a company. Well, what does that mean for implementation? Dr. Reedy was talking about this a few moments ago, that technology is great, but unless it can be deployed and implemented in a way that can be used, doesn't make a lot of sense. This is part of a white paper I published middle point of last year, and you guys can have access to it if you like. Using a platform called Sention. I think Sention is actually based here in the Bay Area, where we were looking at how we could perform doing either short or full long reads for genomics. Now, the cost of the first genome read back when back about 2000, maybe 20 years ago, was $10 billion. And the cost has obviously come down. But you'd probably be stunned at how low it's actually gotten. We did a test with Sention against NVIDIA's H100 system. This is not with our GPUs, this is with our CPUs. And one CPU, one EPYC CPU, outperformed 8 NVIDIA H100s. In fact, more specifically, we processed 151 full genome reads, 47 more than NVIDIA could with their cluster. Now, there are reasons for this. It's not just that our processor just performs well. It's because of the nature of the I/O that's coming in as it's being run. This lowers the overall cost. Well, today, a full genome was probably less than $100 and going lower. In terms of some of the frameworks that they tested against, whether it's Scott-Key or Burroughs-Wheeler, we're anywhere from 1.25 to 2x better performing. What about drug discovery? Well, if we look at the standard workloads, whether we're talking computational chemistry, molecular dynamics, bioinformatics, etc., we're anywhere from almost 4x on GROMACS to 1.7 for Relion or cryo-EM. In many cases, though, this is actually misleading because a lot of this is hybrid deployments where you have both CPU and GPU together. So in effect, the performance could actually be better. This is strictly relegated to just the CPU side. But I'll show you a graph in a moment where we look at hybrid deployments, lowering the overall cost of this technology for medical research and ultimately for clinical delivery. And this is key to be able to democratize all of this for the user base, for the patients that need it. So I'll go back to something Dr. Reedy said earlier, that if technology isn't going to help patients, what's the point of it from the standpoint of investment? Well, if we take that notion and we lower the overall cost, it makes the deployment of that technology that much easier. Look at this. This is an example of lowering the overall cost, not only in physical space in the rack, but the licensing costs, the environmental costs, and physical acquisition costs of those systems that go with it. So this is a comparison, in this case, against Intel 8280, and I know that they've got new models coming out, but the changes remain consistent.
There's also an important cost here for the end user that's using the cloud service. Their rental cost.
Yes. This is not just on site, but Eric is correct. It also applies to the rental costs that a cloud provider would be licensing or renting out to their individual users. So this becomes key for the adoption of any new technology. Look, your average data center in healthcare is roughly 100,000 square meters. 100,000 square feet. Okay, when a new technology comes along, you got two choices. You can either build a new data center or you can reduce the size of the one that you got. If you reduce the size of the one that you got, then you have to start making decisions as to what you're actually going to support on site versus farming out. But even then, those costs don't get smaller, you're simply changing the allocation. Okay, if you can get the same level of performance or better with fewer devices, with fewer machines, and all the associated reduction in costs that go with it. Now you have a winning argument at that point for the adoption of AI. We're talking about adoption of AI at the edge. Can't be done unless you modernize the data center first. And this becomes a vehicle to do that. Potentially, we've mapped this out as a 7-to-1 reduction in the data center. That open space becomes available resources for adoption of AI or other technology platforms that are needed. Especially important in the healthcare delivery system for hospitals that are strapped in terms of resources. We don't talk enough about this, but all of our platforms have embedded security levels, security capabilities in silicon. So as all of you are looking at adopting NIST 2.0 standards at some point, this becomes a key differentiator to be able to tap into some of the information that's collected at the silicon level to be able to do the reporting back on it. I was in Italy for HIMSS EMEA, and the Italian health minister said that this is one of the biggest headaches that they're dealing with in Europe right now, is how to actually meet the requirements around NIST 2.0. So let's look a little bit at inferencing versus training. First of all, AMD is one of the few processor companies that has platforms that run the spectrum from the edge to client to data center to cloud. If we look at the spectrum of inference, okay, depending on what we're talking about, Higgs or TPCX or FACE, what you're seeing here is our 5th generation processor dramatically outperforms other platforms that are available in the marketplace. If we're looking at mixed environments, and this is mostly what you're going to see going forward, is not simply just deployed GPUs, but a mixture of CPU for inference, GPU for training. Then what you're seeing is, again, dramatically better value per invested dollar in those environments with AMD. I have a minute left. Questions? I could geek out on this stuff all day long, actually. Sir.
Thank you. My name is Manjeet Singh. I'm from Molecular Devices. It's a data company. And I want to know, maybe I'm not sure how much of this data can you share. What level of investments have you seen from pharma go up and for AI, and especially for this model that you're sharing?
I can't speak to the whole industry as a whole. I can tell you about individual pharma accounts that we have. It's mixed. There's a lot of talk about it, but I haven't seen a whole lot of deployment yet. And my guess is that the models have to be refined a little more, and the TCO has to be better defined before they do that. No one argues the value, the financial value of putting something like this together. But they haven't found a way to actually make it work and implement it yet. So from a physical hardware standpoint, Supermicro and AMD could deploy all that today, but that's not really the issue. There's issues of workflow that take place. There's issues of where to gather the information to do this. And then there's legal issues. I mean, Prashant went through that, and that's part and parcel of policy that have to be considered. But it's not as widely deployed yet as you would imagine.
Got it. And what's the strategy with AppSci?
I honestly don't know. I wish I could tell you. I mean, I literally learned about this day before yesterday.
No, really.
So I don't know yet.
Thank you.
But look, what I can assume, I mean, Lisa Su is a very smart person. And she wouldn't have invested company resources if that wasn't to be the cornerstone of what we're going to try to develop going forward. And as I said, you'll probably hear more of some things like this throughout the year.
Thank you.
Any other questions?
Yeah.
Yes.
Do you actually offer tools to people to migrate from one platform to your platform?
We actually do.
Okay.
So what I'm assuming you're asking is, so NVIDIA has built their company around CUDA,
Yeah.
and we're open source. So we actually have a tool that will translate CUDA to open source.
Wonderful.
Yes, sir.
Hey, I'm Karan from Reveal Health. So I'm wondering, what's your ecosystem strategy? Because NVIDIA is leading with BioNeMo, and it makes it more sticky, any hardware that they're trying to sell. And it also helps out like researchers in their workflows, because BioNeMo is the testing platform for anything that a biopharma researcher wants to test, any BFM, biological foundation models, etc. So do you guys have an ecosystem strategy, or it's purely hardware based?
It's pretty hard. Well, we have a software strategy as well, but it's not industry specific like that. But that'll be developed. Our whole focus has been to create as much open source as possible, and then let the developers come in and build the models.